Jeremy. And we are just trying to make quorum, so I will let you know when we have. And we just need one more person. Dan, you can get started.
You say we're good to go, or one more?
Yep, we have made quorum. Dan, go ahead and get started. Thank you.
All right, good morning, everybody. Welcome to the Maricopa Regional Continuum of Care Committee meeting. My name is Daniel Davis, Director of Housing at UMOM New Day Centers and COC committee member. Today, I'm filling for one of our co-chairs as Michelle is out sick. First, I want to say that I'm obviously saddened to announce that our co-chair, Stephanie Smith, has resigned from her position at Native American Connections. So her last day on the committee was May 28th. We want to take a moment, thank Stephanie for her dedication and her service on the committee and in the community. I think we all know that she was very committed to seeing her passion lived out in our work, and I'm grateful for working alongside of her. So with Stephanie's transition, we're thankful to have Dee Dee Devine on the committee, now representing Native American Connections. I will now have Sarah commence with roll call of each committee member's name and ask you to introduce yourself and your organization.
Thank you so much, Daniel. Vanessa Cartel.
Yes, Vanessa Cartel, Arizona Behavioral Health.
Great. Hi, Vanessa. Richard Cruz. Okay. Daniel Davis.
Daniel Davis, Director of Housing at UMOM.
Great. Thank you. Kathy Denofi. DC Ernst. DC. And Michelle Jameson is out sick today. We wish her well. Wendy Johnson.
Present.
Great. Hi.
Just a second.
Great. Anne Marie Johnston.
Anne Marie Johnston with Community Bridges.
Hi, Anne Marie. Laura Magruder.
Laura Magruder of Maggie's Place.
Hi, Laura. Jennifer Page.
Hi, good morning. Jennifer Page from Mercy Care.
Good morning, Jennifer. Detective Aaron Rain.
Aaron Rain, City of Mesa.
Hi, Aaron.
Hello.
Nikki Ramirez. Hi. Nikki Ramirez.
Nikki Ramirez, Chicanos por la Causa.
Great. Hi, Nikki. Ty Rosenstiel.
Good morning, everybody. Ty Rosenstiel with Solari Crisis and Human Services.
Great. Hi, Ty. Chayla Schuster.
Good morning, Chayla Schuster from Community Solutions.
Good morning, Chayla. Sarah Sims. Laura Scottnicki.
Laura Scottnicki, Save the Family.
Great. Hi, Laura.
Good morning.
Good morning. Craig Tripkin.
Craig Tripkin, Central Arizona Shelter Services.
All right, great. Thank you, Craig. And I'll hand it back over to Daniel.
All right, did we miss anybody? All right, quick housekeeping statement for all participants. Please mute your phone or computer when not speaking, and please do not put your phone on hold. For all participants, we ask that you please identify yourself when speaking. We'll be reminding people to do that throughout the meeting. I want to also remind everyone of the procedure change regarding the chat feature in Zoom. We operate our committee meetings in full transparency, giving the public access to committee meetings, materials, and discussion. but the public cannot view the chat comments. As a result, we're disabling the chat feature in all the committee meetings moving forward. If you need technical assistance during a meeting, please contact the helpline at 602-452-5095 or contact the MAG staff assigned to the meeting. We appreciate your understanding and helping to maintain transparent discussions for the benefit of the public. One final housekeeping item. All votes will be roll call votes. Sarah will roll call after the motion is made. Our first item, the call to the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov /comment within 1 hour of the posted start time of the meeting. Were there any comments received?
No, there were not any comments today, Daniel.
Thank you, Sarah. We'll move on to the next agenda item. Approval of consent agenda. Our next item is the approval of the consent agenda. Items 3A and 3B is on the consent agenda. As a reminder, please note that committee members may request that an item be removed from the consent agenda if there is a need for discussion. Committee members cannot comment on a consent agenda item without first requesting it to be moved to discussion. Does any member of the COC committee request a discussion on any of these items? All right, hearing none, do I have a motion to approve the consent items? And just a reminder to please state your name.
Laura Scott Nicky. I approve.
Nikki Ramirez, Chicanos por la Causa, I second.
So we have a motion from Laura Scott Nicky and a second from Nikki Ramirez. Now I'll hand it over to Sarah, who will proceed with a roll call. Please indicate clearly how you choose to motion, stating yay or nay.
Great, thank you, Daniel. Vanessa Cartel.
Yay.
Thank you. Richard Cruz. Daniel Davis.
Yay.
Kathy Denofi. Kathy, are you there? I think you might be on mute. Moving right along. DC Ernst. You with us? Okay. Wendy Johnson.
Yes, yay.
Thank you. Anne Marie Johnston.
Yay.
Great. Laura Magruder. Jennifer Page.
Aye.
Thank you. Aaron Rain.
Aye.
Thank you. Nikki Ramirez.
Yay.
Thank you. Ty Rosenstiel.
Yay.
Thank you. Chayla Schuster.
Aye.
Thank you. Sarah Sims. Not yet. Okay. Laura Skotnicki.
Aye.
And Craig Tripkin. Craig, are you with us? You might be on mute.
Aye.
Thank you, Craig. And the motion passes.
Thank you, Sarah.
Yeah.
For our next item, Ty Rosenstiel, committee member and director of HMIS and data resources at Solari, will provide an update of the Learning and Action and Policy and Partnership project and get feedback on the draft charter.
Thank you so much, Daniel. Hi, everybody. My name is Ty Rosenstiel, Director of HMIS and Database Resources at Solari Crisis and Human Services, formerly Crisis Response Network. The presentation that I have for everyone today is referencing a draft governance charter that it was sent out with the meeting materials and is also available on the MAG website under materials for this meeting. So if possible, it would be really wonderful if everyone could pull up those materials to review them while I guide you through the document. Just as background, last month we had a presentation by Linda from the Arizona Housing Coalition on the overall scope of this project. In summary, the three continuums of care throughout the state of Arizona have come together with Access and DES to begin having a conversation about developing a statewide HMIS data warehouse where we would be able to have shared HMIS data across all three of our systems, and to be able to do data matching with the healthcare system to be able to improve coordination between the homeless sector and the healthcare sector. The exciting news was that there was an award of $100,000 from the Robert Wood Johnson Foundation to support the work of this collaborative. And so it looks like this thing is really going to happen. If something is really going to happen, we really need to start having some governance conversations of what would it look like to make decisions as a collaborative group. And that's what this document outlines. So I'm just going to go section by section, give a brief 30-second to 1-minute overview of each section, and then at the end, collect feedback. Right now, this is a draft document that is being presented to all of the stakeholders statewide. So it's being presented to our continuum, the balance of state, Pima County, Access, DES. The goal is that next month, all of us will approve a final governance charter document and actually ratify this and begin working on it. So, understanding that all of us have our own processes, that means right now is the time for us to give feedback. So if we're not going to approve something next month, it would be today or at this meeting at this juncture that we would want to give that feedback and say, no, we have a concern about this particular item. Because if we bring up that concern next month, then we'd have to bring it back to the group and everyone would have to represent that to their respective communities. So the first part is the purpose in the charter. It just outlines the key partners that I've already outlined and said that the collaborative is going to be working to develop the concept of this data warehouse. The next section is the collective activities of the collaborative. There's two sections to this. The first outlines the activities of the collaborative, and the second outlines what would dissolve the collaborative, that this is not a permanent collaborative, but it's really a collaborative that is here to specifically build a data warehouse. So it's the group would be looking to do what would permanent governance look like? What would a permanent privacy structure look like? What does ongoing funding need to look like? If we get this grant or other grants, how do we report on and facilitate those grants? So it's really a temporary group that is here to be able to support the development of something. And we don't know what that something is yet, right? So we need to work together to collaborate to build that. And we're trying to come up with that structure. We'll go to the next page, outlines what would dissolve the group. So we would transfer the ownership of this governance from the small project group to a permanent governance entity. Once we actually selected a vendor, actually built a data warehouse, whatever the group would decide. But again, the key point here is that it's not permanent, right? That we're building the work group to collect input from all of the continuums of care and the state departments participating. The next section is the composition of the collaborative group. The idea is to build a group of people that have a diverse voice across the state. So each of the three continuums of care would get 3 named voting members on this collaborative, of which one of the seats must be designated to a person with lived experience in homelessness. We're looking to have a particular emphasis in ensuring that any data protocols that we have, particularly because we're talking about sensitive data, that we are getting input from persons that are going to be directly impacted by this type of work. So the idea is each continuum of care would have 3 voting seats. And it would have to be a named person because we want that person to come back over and over again. We don't want sort of rotating members in and out throughout the process. That will get really messy. I think that's the key pieces here. We have a section about it being really transparent. So we're going to get the meeting minutes posted somewhere, the meeting notes posted somewhere. It'll be a meeting where anyone can attend, but only the 11 people that would be named members would be voting members. I think that's all for composition, unless there's a voting section. No, that's later. So the next section is meeting and attendance. This discusses the quorum rules, attendance notification, nothing too interesting in that section. The voting section, this one is interesting. In order for a vote to pass on any action item, it says that there must be at least one concurring yay vote from each COC. So each COC would have 3 voting members, and potentially you could see 2 COCs forming an alliance to get a third COC to not or to do something that the third COC might not want to do. This governance agreement says that that's not possible. At least one concurring vote must come from each COC, with a majority 7 out of 11 voting yes on an item. We discussed the next section being organization and committees, just saying that this is an opportunity to, if we do need additional help in operating this, we'll seek that. So if we need to hire a consultant, if we need to hire a project manager to work on this specifically, they would be a non-voting member of the collaborative. Next section is how members are removed. That's pretty straightforward. The next section is code of conduct. This was taken directly out of recommended language from HUD. So we have HUD TA participating in this project, and they gave us code of conduct recommendations of how to do this in a way that would align with federal procurement law. But a big piece of this is that we're saying that the code of conduct will not conflict with the continuum of care code of conduct and conflict of interest requirements. So it's sort of everything that exists for continuum of care conflict of interest in addition to these items. And the biggest piece is that, people that are participating as voting members are not going to be able to participate in like the actual RFP process. So if you're a voting member, you really couldn't be, running the data warehouse in the future. That would be a conflict of interest, that type of thing. Next section is governance, and that outlines the groups that are currently going to be participating in this. So it outlines each of the continuum of care plus access and DES. And the last section outlines that in order to modify this governance agreement, we can do that at any time, but it requires a super majority vote, which just ups the number of votes from 7 to 9 out of the voting members, but keeps the requirement that at least one vote come from each of the continuums of care. So at this point, I want to ask for very specific feedback and questions that you have about this document. Any notes that you share would be shared with the collaborative group that has been designed at this particular point, or that has been convened at this particular point. Any requested modifications would be changed and then brought back to this group and every group with the changes that the other groups requested as well for approval next month. So at this point, I'll hand it back to Daniel and allow for hopefully some feedback.
Thank you, Ty. Are there any comments from the committee members?
This is Laura. I'll just say great work.
Anybody else? Ty is begging for some constructive feedback here. Now's your chance. Well, we've got a packed agenda today, so we will move on to the next item. Thank you, everybody. For this next agenda item, we'd like to get an update from the committee members who are part of the Shared Housing Institute meetings and open it up to the committee to see how you'd like to participate in this initiative. Well, I guess I will do the updates as the person who keeps bringing this up. So as you all know, I'm just going to do a quick refresher. Maricopa County is funding this initiative with the Shared Housing Institute. We're actually part of a national cohort of 4 communities, San Diego, Seattle. I don't remember the other one, but it's listed in last month's notes. And so we've split into 3 groups. We're doing a leadership team, which is making a lot of the decisions on timing and who's participating. Then there's also a task group, which is focused on receiving and participating in the trainings, and then doing a local work group to contextualize best practices to our community. Based on some of the restructuring and the current staffing at MAG, there's not a lot of capacity right now to house the work group at the COC. So we'll be housing that separately under the leadership of Maricopa County. And so far, all the feedback's been really positive. Everyone's really excited. We're trying to get our feet under us still. And I think that's all we have because we're so young in the process. The action, to Ty's point last month, was going to be a vote on having this live as a work group. But the thought process behind that is, you know, often in every community, there's a lot of like initial push for something like this, and then it kind of phases off. So the main question, I guess, would be to the committee to see how not only you'd like to participate in it. I know a lot of members on this committee are already participating in it, but also committing to bringing this up regularly at the committee, not only to hold ourselves accountable, but also to develop buy-in and get the thought leaders in our community, you know, to apply this throughout our region. So are there any comments or other updates from Laura or Wendy?
Well, we're still this is Laura, we're still kind of new into meetings, but I think that this is a great opportunity to expand housing options for families and individuals in our community. And I especially appreciate the fact that Jamie has the experience in the regulations and how to work it with all the HUD requirements for the different funding sources. So I just think that this is going to be a perfect opportunity for us to expand other options for housing in a market that is low and lacking in affordable housing.
This is Wendy Johnson at Justice Center. I just want to say how exciting this project is, and at some point, all of the committee may want to weigh in on some of the implementation plans and things like that to plug the holes that we don't necessarily see. And, you know, overall, this makes sense for the elderly. Just so you know, this makes great sense. And I'm really excited to get behind this, and so is my board. So we're ready to roll here.
Just for everybody's information too, the Arizona Community Foundation awarded $250,000 to the shared housing project in the East Valley for seniors. And we're working on finding where some of the overlap is, especially since some of the matching process is going to be developed by ASU, and Cricket from ASU Nexus is part of the leadership team. I'm going to just briefly run over the members who are involved, so just for transparency's sake. Obviously, Rachel Milne and Scott Hall from the county. I'm on the leadership team. Laura Scott Nickey from Save the Family, Richard Cruz from the campus, Liz DaCosta from CBI, and Cricket Wethington. I've never read her last name, Wetherington, from ASU Action Nexus. And then for our implementation group, These are really the leaders in the organizations who are going to be doing the work and contextualizing it. Mila Valle at UMOM, Wendy Johnston from Justice Center, Matthew Bress from Human Services Campus, Anne-Marie Johnston from CBI, along with Michelle Beck from CBI, Melissa Leathers from Save the Family, and Sarah Kent, our awesome Human Services Planner from MAG. We also have a schedule, so it's going to be 12 weeks, and it kind of goes back and forth between what the leadership team needs to get from the community to make this successful, the task group meeting, going over the trainings, like I said, contextualizing, but also developing a lot of the tools like the matching system, and then starting to do the train the trainers model on housing first, supportive housing and CTI, progressive engagement, housing match, stabilization and conflict management, and then landlord engagement. So we'll be able to give updates on that as we go. All right, any other comments?
I have a comment. This is Shayla Schuster from Community Solutions. There's a couple things. Like one, I just also want to just reiterate how great I think this work is and how much like it's needed. My parents are currently selling their house and moving to a rental property, and their realtor said there's 3,000 rental units in all the state of Arizona. I don't know if that's accurate, but I mean, I imagine that's pretty close. So I think we have to look at alternatives like others have said. And so really glad that people are focusing on this. Two comments that I have are, one, is there a youth provider that might be part of that implementation team? Because I do think that for young people, it's a really natural, normal, and important place for young people to be in shared housing. So I just noticed that you had Mila from UMOM and you guys do youth provider, but I didn't know if you had anyone else. And I'm not sure what all the agencies do, but I just wanted to put that out there. And then the other thing too, is that I really get the sense that this is like a cultural change, much like not exactly like permanent supportive housing, but kind of like that, like housing first, like it's a flip-flop. It's a way that we view our system that's very different. And so it seems to me like there's got to be a way to like really entrench the community into understanding and embracing shared housing as an option, not as a requirement, because that's another whole thing. But so I just want to put that out there as you're thinking about that, if there's ways to like really sort of get all of the committee members and all of the other COC members and even other like stakeholders involved in really embracing that culture.
Yeah, that's a great call too. I think we've all been surprised how much of a culture change it's going to be, is what I'll say. So we're happy to be making this commitment. Any other feedback?
This is Nikki Ramirez with Chicanos for La Causa. Sorry, I just wanted to say that CPLC is happy to be a part of the process in whatever way we can to support that or add feedback. We have seen an increased need amongst our clients as well to explore alternative housing options, as their search processes have not exactly been as easy as they used to be. So I would just like to volunteer that wherever that might fit best.
Daniel, this is Dee Dee with Native American Connections. So Chayla, thank you I was going to bring up the youth shared housing for youth is really a particularly effective, strategy for youth. So I would like to also, I didn't see Native American Connections involved. So even if it's just on the youth side, I'd like to offer that as well.
Awesome. We will definitely take both of you up on that. We'll be reaching out separately. And that's awesome. This is exactly the kind of buy-in we're looking for. So glad everybody's going to make sure this is successful. Anything else? Thank you. We will move on to the next agenda item. Nikki Stevens, Regional Homelessness Program Manager at MAG, will provide an update on public and Indian housing and, emergency housing voucher program allocations.
Yeah, so many of you know our community was awarded with some emergency housing vouchers that are going to be going to our public housing authorities. I'm happy to report that all the public housing authorities that have been allocated these vouchers have accepted them. So that'll be another over 700 vouchers that are coming into our community. Currently, right now, we're working on MOUs with each of the PHAs and working with our HUD technical assistance advisor to ensure that the MOUs are capturing what HUD would like it to capture, and that we are serving people through the coordinated entry system. So for our PHAs, many of them are not familiar with our coordinated entry system. So I'm putting on a coordinated entry 101 forum on Friday, the 11th. I know I've gotten, poor Tina Lopez on MAG staff. We've gotten inundated with so many people that are interested in this subject, which it speaks to the need to continue to provide this type of education for the community. So that will be happening Friday at 12, from 12 to 1:30. If you're interested, email me and I can get you that information. Other than that, we're just working to get the MOUs executed and ensuring that we're able to serve these individuals. I'm excited because I think this is an opportunity for our community to show how we, from the homeless provider perspective, how we can work with our public housing authorities. I think this will be a great demonstration for the community. There's a lot of wiggle room that HUD has allowed for us to work with. So I'm excited about it. And if you have any questions, you're welcome to reach out to me and I'd be happy to answer them. Thank you.
Thank you, Nikki.
I should ask, is there any questions now? Well, thank you all.
Any questions or comments? All right, I would just say good job, Nikki. I know you're an integral part of getting all the authorities to accept that, so great work. An update will be provided on legislative issues of interest, as well as the Maricopa Regional Continuum of Care Board and Subcommittee members will be providing an update of the recent activity. This item was requested as an ongoing agenda item. Excuse me, it's my first time reading in public, apparently. An ongoing agenda item by the COC committee to remain informed about the work taking place legislatively and in various subcommittees. So we're going to start with the COC board. Joan Service, Executive Director with the Arizona Housing Coalition, is going to provide a legislative and board update.
Hi, good morning, everybody. Everyone can hear me okay?
Yes.
Thumbs up.
Yeah.
Okay, good. Fantastic. Thank you. We had the board meeting. It was only a couple weeks ago, and it's all already out of my head. So I pulled up the agenda, and ultimately, a lot of it is stuff that's already been discussed at this level. In terms of, Nikki just discussed. We had a conversation at the board around the emergency housing vouchers and what an opportunity that we have. As we've all said, or as I've heard before, a once in a generation opportunity that we really should be seizing. The other conversation that was brought up at the board level was around the VA data requests and the idea of providing that HMIS report on a weekly basis of the by name list for the VA data and some of the kind of ability to reconcile that data, as clunky as that might be. A lot of conversations around the regional homeless strategies portfolio, which hopefully you all will be attending the capstone event tomorrow at 2 p.m. And then the Maricopa Regional Continuum of Care Board adopted mission, vision, and values. And I wanted to pause and see, has that been shared, or would you like me to review that with you all?
I know Ryan had given a previous update on it.
Okay.
Unless there are any changes to it.
I don't know. Sarah, can you help me out? Was there any changes?
Nope, not since Ryan presented.
Okay, fantastic. And so I'm going to pause and see if anybody has any questions. That's pretty much the high level board kind of update. I can transition to talk about legislative activity and inactivity if you'd like to. I'll pause, see if there's any questions. Okay, hearing none. So Activities at the state legislature. Obviously the clock is ticking. June 30th is the end of the state fiscal year, and so a budget needs to be adopted. We always hope that by Memorial Day weekend we'll have a state budget. There's always kind of a rush up to Memorial Day weekend. Unfortunately, this year we're going to make it close to the wire. There was an initial thought that a budget would be approved, and we saw early glimpses of what was included on those budget documents. Unfortunately, there were some holdouts, and I think the big kind of pressing issue has nothing obviously to do with housing and homelessness, but more to do with the flat tax proposal that's being shopped by some lawmakers. As of Monday, actually, so a couple days ago, that proposal fell flat on its face again, and the legislature is supposed to reconvene tomorrow and hopefully hammer out a budget. Now, I will share that the Housing Coalition has been obviously, we have two policy priorities going into this legislative session. One was enacting a state low-income housing tax credit, and the second being restoring the State Housing Trust Fund. We knew it was going to be an uphill battle to restore the State Housing Trust Fund in light of the influx of federal funds. And so we tempered our ask, and we're recognizing that next legislative session, we really need to make sure that the state invests more around the Housing Trust Fund, because we anticipate a federal funding cliff. However, so we put a lot of emphasis on getting a state low-income housing tax credit enacted. And as I mentioned, the budget fits and starts. It did include a state low-income housing tax credit initially. Since then, we've had some opposition from some of our conservative lawmakers that would like the state low-income housing tax credit and the angel investment tax credit taken out of the budget package. And so that doesn't mean that the bill is, or the concept is dead. It just means that it will be a discussion independent of the budget. We wanted to, we thought, might as well put it in the budget because they're passing broad policy that way anyways. So we still hope to have the state low-income housing tax credit. It will be a smaller version that we had hoped, but we'd like to at least get the concept passed in theory and join about 25 other states that have a state low-income housing tax credit, and then build upon that success. And ultimately, the goal here is obviously with the state low-income housing tax credit, you provide some more resources to build more affordable housing, and that's clearly what we're all singing that same chorus. So the budget, we hope to have a budget soon. We'll see, but ultimately that standalone bill, which we don't have a bill number yet for it, but that standalone bill will happen after the budget passes. But I will share some good news around that leaked budget documents. Obviously, as I shared, they took out the state LIHTC, but there were some inclusions that are important to us as in our sector. A couple of those things are, there is the initial budget leaked document includes a provision for $1 million going to homeless youth and families, actually going to DES for homeless youth and families, beginning in fiscal year 24, and with the idea that fiscal year 22 and 23 would actually be an investment from some of the federal funds. The other thing is there is an increase in the AAAs, the area agencies on aging. They would actually receive an additional $1 million to provide some support for seniors. There's kind of some vague language because of the inability or the difficulty in mixing and matching federal and state funds. There's a discussion of a policy provision that would direct the Department of Housing to provide funding for a West Valley shelter. And then there was also an additional $100,000 from the department going to the Department of Health Services for homeless pregnant women. So those are the kind of key additional funding streams that we're pleased to see included in the budget, but we're also hoping that we can get some of our policy priorities passed. So happy to entertain any questions or comments.
Joan, and sorry, I was mistaken. I don't think that the committee has heard the final mission, vision, and values yet. I'm happy to pull that up as well if that helps.
I'm happy to just, well, yeah, maybe, let's pause for a second, see if anybody has some questions on the legislative.
Perfect, thank you.
Okay, well then I guess take it away, Sarah.
No questions on legislative stuff? Okay, so the board did approve at the last meeting the vision, mission, and values, and I'm happy to share my screen if Jeremy would please make me a host. Thank you. Okay, and can you see my screen okay?
Yes, we can.
Okay, great. So the approved language is our mission is a region committed to anti-racism, free of discrimination, where all people have a safe place to call home. The mission of the Maricopa Regional Continuum of Care is to unite and ignite our communities to prevent and end homelessness. Then the top 6 values, data-driven. We use quality data to make decisions and drive results. Solutions-focused. We focus on solutions and deliver results with a sense of urgency. Equitable outcomes. We provide individual services so each person can end their homelessness regardless of barriers. Inclusion, we cultivate an atmosphere of openness and incorporate people with lived experience to share their knowledge, wisdom, and expertise. Nimble, we take risks and seize opportunities for innovation. And lastly, excellence, we are fully committed and accountable to excellence. So that is what the board came up with, and well done.
Are there any definitions for what some of those, phrases in the mission mean? I know anti-racism is a new thinking framework for, most of the nation. So yeah, is there any discussion on specifically what that would look like here or what that means?
Yeah, that's a really good question, Daniel. And I'll bring that back to the board to see about, defining that exactly for this vision here. Mm-hmm.
Joan, the only question I had for legislative, and by the way, this is just the nature of the beast. You've got the most talkative person being the facilitator this morning. But what has been, what seems to be the most effective way to change minds around LIHTC specifically?
Honestly, I think this is something that COVID has prevented us from doing, but ultimately, showing our legislators the properties, right? I know that Valley the Sun United Way did a kind of a driving tour not too long, well, gosh, it's probably about 3 or 4 years ago now. And I think maybe we need to dust that off and look at doing something like that again. Ultimately, I think we've built up this conversation over the past 3 or 4 years now. We've built support on both sides of the aisle, but it really becomes down to a competing priority conversation with all the others, frankly, social determinants of health, education, criminal justice. It's how do you balance it all as a lawmaker? I sure as heck don't want to make those conversations or those decisions, but if I were, I would say we need to invest in housing because home is the baseline. Home is that cornerstone. I see Dee Dee popped in, and I know that she's a strong LIHTC advocate, so I'd love for her to share a few words.
I was just going to say to everything you said, Joan, I agree with what Daniel's specific question was about legislators, and they see it as a tax credit. And they don't like anything that says tax credit. So, that's I think the basic core to not really jumping on board, because nationally it's the single most effective way to increase your housing stock. And, they did, I do hope that we have our local state, tax credit to support the LIHTC development. But I think I agree with Joan that it's just, we got to show them the quality of the housing. And then they get into, you know, what it costs per unit and all that kind of stuff. So it's, you know, it's really complicated, but I think we just keep attacking. And I heard Chayla say earlier that she heard there were only 3,000 units available to rent. And we used to have 50,000 units in Phoenix metropolitan area before the 2007 downturn. So whether it's 3,000 or 5,000 or whatever it is, it's not 50,000. And so, and we've determined there's a 180,000 unit shortage across the state. So we just have to keep drilling at those kind of things. And that LIHTC is generally both the 9% and the 4% credits are really the avenue to bring on new housing stock. And then all the other things that have been talked about with shared housing and you know, the single family units, density, zoning, all those kind of things in combination. But I think in general, the legislature here's tax credit, and we have such a conservative state legislature around any additional tax credits.
Thank you, Dee Dee. That's, yeah, spot on. I completely forgot to mention two other things that if we still have time, I'd like to mention. The first is, you all might have heard about the rumor around a bill, House Bill 2668, put forth by a group called the Cicero Institute to create a structured camping facility. So I will share that we believe that piece of legislation, no one ever says it's over until it's over, until they adjourn sine die. But at this point, we believe that that piece of legislation has died this legislative session. But I'm really clear to say that this legislative session, because Cicero Institute has been successful in adopting a similar version of that bill in Texas. And so I'm pretty sure they're going to come back next legislative session. So we really need to build up some talking points against. But I also will share that I think that's really exciting that we have Director Simplot at the helm at the Housing Department, because he seems real apt to take on the conversation and look at innovative ways to address our housing shortage. And then lastly, the other point that I forgot to mention, and I got to say that the Housing Coalition, well, Joan, has been slacking in getting the correspondence out. We are the state captain for the National Alliance to End Homelessness. They're having their their Capitol Hill Day, virtual Capitol Hill Day on June 16th. So just basically a week from today. We are, and I'm going to take some credit because we haven't pushed the correspondence out to our members, but our members of Congress are slackers because they're not getting back to me on some scheduled dates. So we only have one. I was just focusing this, Capitol Hill visits on our representatives, and only one of our 9 have gotten back to me so far. So they're slackers. But we'll schedule some meetings, and we'd love for folks to join us. Just send me an email, let me know about that. We'll also do an email push to our members to register once we get more meetings scheduled. So happy to entertain any questions on that as well.
All right, hearing no questions. First off, Dee Dee, it's a great first meeting topic for you to be here for. I know you are quite the expert on that. Second of all, it sounds to me like we should all come with great appetites to the capstone event on how we can rally our organizations and our supporters and our community impact around a common strategy and how much influence we can have on the community. It looks like Matthew Kelly is on. So we will hear from the Coordinated Entry Subcommittee Chair, Matthew Kelly, lead housing liaison with Mercy Care.
Hi, thank you all for having me quickly. I will try to be very quick. I'm not sure exactly how full your agenda is today. First and foremost, I think everybody is probably already aware, but the Coordinated Entry Subcommittee over the last 3 months or so had been working on policy and procedures to update for racial equity language that had come through your committee and then also was approved at the last board meeting as well. I think in addition to that, we continually are looking at some of the operations manuals and evaluating things. As you'll see, we did have a slight update with regards to the progressive engagement policy for both the singles and the families on the operations manuals. So while we're doing some of that really boring work related to policy and procedures and ops manuals, which we all know we hate, nonetheless, some of the other stuff that we're doing, which I think is a little bit more exciting. So as part of the coordinated entry subcommittee, we did start a work group surrounding racial equity. And really with this particular group, what we're really trying to focus on is looking at other communities in the country at this point in time and what sort of new and or different models they may have put into place to address racial equity. We all know that the VI sped out has come into question, and so we're trying to figure out what we might want to do moving forward. And rather than recreate the wheel as a community, we thought it would be good to look at some other communities across the country who've already made some changes. So on our list for possible communities that we're kind of looking at, the first and foremost close to home, Tucson, Pima. In addition to that, Pierce County, Houston, Texas, Orlando, Florida, and then also Minneapolis, Minnesota are the communities. So we're working with Jeff Olivet to reach out to those communities to make some connections, to have them come and do some presentations so we can start to learn what they're actually doing specifically related to that. So it's exciting work. I think it's going to be slow like molasses. However, I think we've started the conversation, which is exactly what we need to be doing moving forward. The other thing that the Coordinated Entry Subcommittee is also working on is the integration of the ESG CV prevention dollars into the Coordinated Entry system. So I'm not sure if everybody is familiar, but all homeless prevention providers do need to actually run all of their programs through the Coordinated Entry system for the CV dollars. And so we have identified all of the HP providers in our community. We did send out a questionnaire to all of those providers to find out how they're currently operating as a program, what their barriers are, maybe if they're using any sort of prioritization. And based upon that, we are taking that and kind of developing an actual prioritization tool that we're going to be using across the system to more or less standardize the use of those prioritization for those HP dollars. We're in that initial process, and we are lucky enough to have Christy, and I don't know why I just forgot her last name, from DES, who's helping us out. Why did I forget it? Help me.
Parker.
Parker, thank you. Christy Parker from DES is helping us out. So she's sort of the guru on the HP dollars. So she's been a great resource for us. So we're going to be continuing to focus on getting that feedback, reviewing that, and then also we are going to be inviting all the HP providers to the meeting as we develop that prioritization tool and start to move forward to implement that and kind of dealing with what that's going to look like with the coordinated entry system and how we're going to integrate that, so that I think being thoughtful for the coordinated entry leads, not dumping a whole lot of additional work on their plates, but also making sure that we're meeting the requirements of HUD to integrate HP into the system. And that's all. Those are my major updates. Are there any questions? Okie doke.
Nikki Ramirez with Chicanos for La Causa. I see that this is the item on the agenda for action for approval of the progressive engagement section. Is that correct?
Correct.
Okay. My only question, and it's not just for this particular set of policies and procedures, but for all future reviews that we do, if we could receive a copy that's redlined so that we can see what changes were made versus what changes were not made, I feel like that would be helpful. But other than that, I don't have any other questions.
Okay, I think we can definitely make arrangements to do that. I know that in the future, we're probably looking at a couple of other sections, especially I think with some of the racial equity discussions, there's definitely going to be some updates to the ops manuals as we move forward. So we can make sure to do a track changes doc. So thank you.
Thank you.
Absolutely.
All right, and Sarah, I see it as it's listed as just information and discussion. Is that correct?
That's correct. Yes, it's not up for vote today. No.
I just had a question for Mr. Kelly. How are providers from various interventions outside of just coordinated entry, how is their input sourced for these kind of changes, especially around progressive engagement? Is it mainly their involvement with the subcommittee?
So the subcommittee leads were the primary authors of this document, but in addition to that, that's been part of our open meeting. The coordinated entry subcommittee is actually, and I'm glad you mentioned this, Daniel, because I was going to mention it to this group. We are, while we're not technically a formal meeting that is quote unquote open, we do have a pretty open policy. So anybody who wants to come to that meeting is welcome to come and provide feedback. We see coordinated entry as a pretty important part of our community, and I think we'd rather have more input than less input, and I'm not interested in restricting that. And at this point, we've found it to be beneficial rather than a hindrance to the process, if that makes sense.
That definitely makes sense. Thank you.
Yep. Absolutely. So if you are interested, right now, Julie Montoya is actually kind of managing the invites and all of that information. So if you're interested in that, you can either reach out to me or to Julie Montoya for an invite to that meeting. We're happy to send that out to you. Even if you're not going to come to it every single time, we'll get you on the distribution list per se.
I just know that especially for rapid and even some of the transitional housing and homeward bound, but there's a lot of discussion around progressive engagement, and the manual says, 90 days minimum, but in practice it ends up being 6 months. Or the singles manual, it says 6 months for progressive engagement to a higher need intervention, but there's just a lot of talk around how we can make that a little more effective. Most of that was shared at the ESG funders listening session a couple weeks ago. But speaking of Julie Montoya, we're going to hear from the racial equity leadership team lead, Julie Montoya, the Human Services Planner with MAG.
Thank you so much, Daniel. Appreciate it. Can everybody hear me okay?
Yes.
Okay, thank you. So the racial equity work is continuing, and just as a reminder, the 4 priorities are coordinated entry, lived experience, data, and workforce. Thank you to Matthew Kelly for giving the update on the coordinated entry piece. Other updates, I'd like to give a shout out to my colleague, Sarah Kent, who's been leading the efforts in developing a lived experience council. They'll be meeting this coming Friday for their 3rd meeting, I believe. They're identifying areas that they're interested in being a part of and how they would like to see themselves involved within the COC. Part of asking folks with lived experience to be included in is making sure we're not tokenizing or checking a box, but respecting and honoring their expertise and their time. We as a community are looking to identify ways to incentivize and pay them for this time and expertise. If anyone is interested in participating or has some ideas to share, please reach out to Sarah. We also have a data specialist cohort that is meeting monthly, and they're working with the HMIS team to create an organizational data toolkit that organizations can use to identify and analyze their own data through a racial equity lens. So we'll keep you posted on this, but we're hoping to launch this within the next couple of months, thanks to this group and HMIS for developing this tool. We're also continuing to receive support through racial equity partners in all of these efforts. So we had a good response to the trainings that were facilitated earlier in the year, and racial equity partners will be hosting more trainings in July, August, and September. And as we finalize those dates, we'll send out the information to our mailing list. We're also hoping to be able to have them come out in person. That was kind of the goal initially through the assessment process, but that wasn't able to happen. So if health guidelines permit, we're hoping to have them come out this fall. They've been invited to the Arizona Housing Coalition Conference in October, and we're hoping to be able to build some time around those dates where they can come out and visit and meet with us all in person. So again, we'll keep you posted. We'll keep the committee updated monthly. That concludes my update. Thank you.
Thank you, Julie. Any comments? I tell you what, we're just absolutely killing it on the first part, the information, but the discussion is a little work on. We're going to hear now from Maggie Wong and Nicole Funicelli on, Maggie Wong is a research analyst with MAG, on an update of the Hand Up dashboard and give us a demo of the new advancements.
Thank you, Daniel. Can everybody hear me okay? I'm Nicole Funicello. I'm a GIS analyst at MAG. Maggie's not here today, but I will give you the update. I just wanted to let everyone know that the Homelessness Assets and Needs Data for Unified Planning tool, short name Hand Up, is on track for launching on Friday. It will have a password, and keep an eye out for an email with the link. We've demoed the tool at previous committee meetings and do appreciate all your feedback. We're finalizing the tool as we speak and incorporating all the feedback. So no demo today, but keep an eye out for the email. Like I said, should be coming your way on Friday, and let the COC team know if you have any questions after receiving the link and taking a look at the tool. As discussed previously, the tool includes contextual data from the census, HMIS, and AZ211 call data, as well as data on unemployment and evictions. These will be available in the map layers section, which you can access and turn on and off. They will be background maps provided for context. They will be showing data by zip code or by block group. And there will be a tutorial built in to the viewer in case you forget what I just said, that you can access anytime. We hope that this will be a useful tool for regional planning and around homelessness services and programs. Thank you very much.
Thank you, Nicole. I even practiced your name. It's still terrible. I use the plural. Any feedback? Questions?
Vanessa from ABC, just wondering, Nicole, which stakeholders will be granted access to this tool?
So I'm going to divert that to Sarah. I'm not sure exactly who's going to be getting the first pass. Definitely this committee will be. And in addition, Sarah, do you know who else will be getting access on Friday?
Yeah, I'm not completely certain of that. I know we're working that out as a team, and MAG staff, feel free to jump in if you have more information on this than I do. But yeah, we will keep you all very closely posted.
Hello, I can jump in for a moment on that point. So right now we're planning on the Continuum of Care Board, the Continuum of Care Committee, and all of the subcommittees receiving the link as well as the password. And then we will be providing that as well to our member agencies, which include the cities, towns, counties, and Native nations. So that will be the initial launch. In the future, we do hope to have a public-facing side of this, but we really just want to make sure that everyone has had an opportunity to really be able to dig into the data, let us know of any changes, and then we'll be able to roll out that more public-facing version of it relatively soon. Thank you.
Thank you. Any other comments? Points of discussion? So lastly, there is a request for each subcommittee and committee from the board to discuss and record our membership needs and concerns. Then the board will take a look at what comes back and see what the next step should be to fill some of the gaps. So please send all needs and concerns for the committees and the subcommittees you sit on to MAG staff Sarah Kent. All right, moving on to requests for future agenda items. Do committee members have any action or discussion items for future meetings?
This is Nikki Ramirez with Chicanos for La Causa. I would like to explore small area fair market rents and the option that our COC has to utilize small area fair market rents instead of the standard fair market rent. I think that we can explore the benefits and the risks to making that adoption, the process that it would take for us to do that, and then eventually hopefully take action to vote on whether or not to make that change.
Noted. Anybody else? This might be the last time they ask me to do this, lead this meeting, so I will call on people if you guys don't have anything. Nothing from Ty Rosenstiel? Nothing?
Put me on blast. Nothing from me, Daniel.
All right. Whatever, man. Okay. For this next agenda item, comments from the committee. Is there anyone on the committee that has any other announcements or events that they'd like to highlight? The main one is obviously the capstone event. Please prioritize attending and coming with an open mind and just being willing to take on what is presented. And I have no idea what's going to be presented. I'm just saying, we should all buy in.
Daniel, this is Laura Magruder with Maggie's Place. And I just wanted to say that over the last few months, we've been finally opening up the beds that we had put on hold because of COVID and being prepared for isolation and quarantine. So we have a few spots available. We're a small scattered site model that services homeless pregnant women. So if anybody has any clients that are looking, we do have a few beds open and I'd love to fill them before it gets any hotter. Thanks.
Anybody else? All right. Thank you. I want to remind all of the committee members that we will not have a July meeting. It's too hot to even meet virtually. So I hope all of you enjoy your time off. The meeting is now adjourned. Have a good day. Bye-bye.